A new study in the journal Pediatrics has found the whooping cough vaccine loses its effectiveness over time. So for children who received all of their shots, the vaccine was 73% effective in the first year. But after 2 to 4 years, the vaccine's effectiveness plummeted to just 34%. Joining me now is Dr. Jennifer Caudle, a physician and health expert. Dr. Caudle, thanks for being with us this morning.
Thanks for having me.
So what do you tell parents at this point? Do they still get the whooping cough vaccine for their kids, even though it's losing its effectiveness over the years?
The simple answer is absolutely. We still want to get vaccinated. And quite honestly, vaccination is one of the best protections that we have. Whooping cough is a highly contagious condition. It can be traveled through the air, it can be gotten, and can cause quite serious consequences. Even though this vaccine might have reduced effectiveness over some years, we still want people to go out there and get that vaccine.
Do we know why it's losing its effectiveness?
Well, not really sure why. And this is something that we see with different vaccines. And one thing with this sort of Tdap or tetanus, diphtheria, and acellular pertussis vaccine, that's what we're talking about. That's got the whooping cough protection in it. We're actually just doing some studies now, and we're learning more about the vaccine and how it works and what we're going to need to do. Right now, there are no recommendations for a booster vaccine per se, but, this is often how we come up with recommendations over time. So, we do see this with other vaccines as well at times, but I think it's really important to know, but it's also still important to remember that even despite this reduced effectiveness that we're seeing in this one particular study, we still need to make sure that our kids are getting vaccinated and that parents and adults are vaccinated as well.
And what about whooping cough itself? Is this something that we're learning more about? At one point, people could think that it was nearly eradicated, and yet we did see an outbreak.
Yeah, and that's very true. It's a really good point. Actually, in the year 2012, there were over 48,000 cases of whooping cough reported in the United States. This is something that's still around. And we do think that, yes, the outbreaks in Washington may be due to this decreased effectiveness of the vaccine that we're talking about. But whooping cough really is something that is out there. We're seeing more of it. And like I mentioned, especially in kids, it can be very dangerous. It can actually be deadly in some. Some of the symptoms, the term whooping cough, think about that word and what that means. Really, that's the symptoms people get. They get a cough that keeps going and going and going and doesn't stop. And after the cough, you get this high-pitched characteristic whoop as people are trying to get air and they're breathing in. So it really is a whooping cough, and it can cause lots of problems.
And how, if you do happen to have whooping cough, let's say that you were not vaccinated ahead of time, how do you treat it?
Right. So if you haven't been vaccinated ahead of time, this is, once again, I'm on my soapbox and I'm saying make sure that you get vaccinated. Also, pregnant women should be vaccinated. If you're going around young infants and children, make sure that your vaccines are up to date. And of course, I always am an advocate of following that routine vaccination schedule that we have. But as you ask, if we do think that we've been exposed to whooping cough, we think that we might have the symptoms of whooping cough, go see your doctor immediately. And the reason why is because it can be treated, okay? And we can do tests to see if you really have it. So we can do something about this, and that's a really good thing. But of course, what we want to do is prevent it from happening in the first place.